Welcome to this video on leptospirosis-associated nephropathy. We'll delve into the details of this serious kidney complication arising from leptospirosis infection. We will be discussing its causes, how it affects the body, its prevalent symptoms, diagnosis, treatment, and methods for prevention. Leptospirosis-associated nephropathy is caused by infection with pathogenic bacteria of the genus Leptospira. These bacteria are zoonotic, meaning they are transmitted from animals to humans. Common animal reservoirs include rodents, cattle, pigs, dogs, and wild animals. Humans typically become infected through contact with contaminated water, soil, or animal urine. The bacteria enter the body through breaks in the skin or mucous membranes, leading to systemic infection and potentially affecting the kidneys. The pathophysiology of leptospirosis-associated nephropathy is complex and involves direct and indirect effects of the Leptospira bacteria on the kidneys. Firstly, Leptospira can directly invade the kidney tubules, causing tubular damage and dysfunction. Secondly, the infection triggers an inflammatory response. This inflammation contributes to kidney injury. This combination of direct bacterial damage and inflammation can result in acute tubular interstitial nephritis, which leads to impaired kidney function, electrolyte imbalances, and potentially acute kidney injury. Leptospirosis is a global disease, but its incidence varies significantly depending on geographical location, climate, and socioeconomic factors. It is more prevalent in tropical and subtropical regions with high rainfall. Occupational exposure is a significant risk factor. This includes professions such as farmers, veterinarians, sewer workers, and those involved in outdoor recreational activities. Outbreaks are often associated with flooding and poor sanitation. The symptoms of leptospirosis-associated nephropathy can vary widely in severity. Early symptoms of leptospirosis often include fever, headache, muscle aches especially in the calves and lower back, chills, vomiting, and red eyes. As the disease progresses and affects the kidneys, symptoms such as decreased urine output, swelling, edema, particularly in the legs and ankles, fatigue, nausea, and confusion may develop. In severe cases, kidney failure can occur, leading to more serious complications. Diagnosis of leptospirosis-associated nephropathy involves a combination of clinical evaluation and laboratory testing. Blood tests can reveal elevated levels of creatinine and blood urea nitrogen subun, indicating impaired kidney function. Urine analysis may show proteinuria, acid protein in the urine, and hematuria, blood in the urine. Specific tests for Leptospira include blood cultures, PCR sample polymerase chain detect bacterial DNA, and serological tests, such as the microscopic agglutination test AMETA, which detects antibodies against Leptospira. A kidney biopsy may be performed in some cases to confirm the diagnosis and assess the extent of kidney damage. While leptospirosis-associated nephropathy doesn't have distinct subtypes, it can be classified based on the severity of kidney involvement. It ranges from mild renal dysfunction to kidney injury requiring dialysis. The severity is determined by the degree of tubular damage and the overall impact on kidney function. The treatment of leptospirosis-associated nephropathy focuses on eliminating the Leptospira bacteria and supporting kidney function. Antibiotics, such as doxycycline or penicillin, are typically administered to kill the bacteria. Intravenous fluids are given to maintain hydration and electrolyte balance. In cases of acute kidney injury, dialysis may be necessary to remove waste products and excess fluid from the body. Supportive care, including management of blood pressure and other complications, is crucial for a positive outcome. Prevention of leptospirosis involves reducing exposure to the bacteria. This includes avoiding contact with potentially contaminated water and soil, especially in areas known to have Leptospira. Wearing protective clothing, such as boots and gloves, is recommended for those at occupational risk. Rodent control measures are important to minimize the spread of the bacteria. Vaccination is available for animals in some regions and may be considered for high-risk individuals. The prognosis for leptospirosis-associated nephropathy depends on the severity of the infection and the promptness of treatment. With early diagnosis and appropriate treatment, many patients recover fully. However, severe cases can lead to chronic kidney disease or even death. Recent research is focusing on developing more rapid and accurate diagnostic tests, as well as exploring new therapeutic strategies to minimize kidney damage. Further understanding of the inflammatory pathways involved in the pathogenesis of leptospirosis-associated nephropathy may lead to targeted therapies to improve outcomes.